Earlier today, Dr. Redfield confirmed that it looked like November, December, the first doses would be able to be distributed. But then he said that the vaccine for the general public likely would not be available until probably next summer, maybe even early fall. Are you comfortable with that timeline?
No, I think he made a mistake when he said that. It's just incorrect information. And I called him, and he didn't tell me that, and I think he got the message, maybe confused, maybe it was stated incorrectly. No, we're ready to go immediately as the vaccine is announced, and it could be announced in October, could be announced a little bit after October.
He was pretty clear in the way he said it.
Yeah, well, I think so, but I don't think he means that. I don't think when he said it, I believe he was confused. I'm just telling you, we're ready to go as soon as the vaccine happens. I think the results will be early and strong. The safety has to be 100%, and we're going to insist on that. And obviously, the companies are going to insist on that also.
So could you put an actual date, like January, February, March?
Scott, what would you think?
Yeah, as I said, the high priority people will have in sometime no later than January. I mean, of course, it depends on when things are approved and the emergency use is given.
I'm talking about the low
understand.
priority
Yeah,
people.
I can finish.
Yeah.
And then it's anticipated there will be 700 million doses by end of Q1. That's 700 million doses.
So by the end of March.
That's end of Q1.
Dr. Atlas, do you mind if I ask you a question?
One, you said you spoke with Dr. Redfield earlier, and you said that he made a mistake.
I think he made a mistake. Yeah, I didn't go into any great depth. I was very surprised to hear it. It doesn't really matter. We're ready to move, and it'll be a very full distribution.
So y'all had the call. You said that you told him that he had made a mistake. What was his response?
No, I didn't tell him anything. I said, what happened? And I got the impression that he didn't realize he said what he might have said. I didn't see him say it. But if that's what he said, it's a mistake, because here's, sir, ready? We're ready to distribute immediately to a vast section of our country and then beyond, because we want to help other countries also. But we're ready to distribute immediately.
But the timeline that he gave, saying that it wouldn't be ready for the general public until the middle of next year, sounds very like the one that you kind of just offered.
No, I said that there'll be 700 million doses by end of Q1, and everyone in high risk will have it sometime no later than January.
Yeah, he was talking.
That's
he said the general public for next year.
We are
He
focused.
wasn't talking about high risk.
As you know,
Caitlin,
we're focused on high risk, but we're going to focus also on general public very much. But our immediate aim is elderly people, and especially elderly people with heart, diabetes problems. But we will have it. We're not looking at a small distribution program. We're looking at distributing to the whole United States with an immediate focus of the elderly.
Mr. President, the director of the CDC also testified today that a mask, in his estimation, is guaranteed to protect the American public more from the coronavirus than a vaccine. You have, as detailed, poured a lot of resources into a vaccine development. Why not devote your energy?
And to masks.
Why not devote your energy now to a campaign to have all Americans wear a mask, something that, if more effective than a vaccine, would also help the schools and the economy?
Okay, number one, it's not more effective by any means than a vaccine, and I called him about that. Those were the two things I discussed with him. And I believe that if you ask him, he would probably say that he didn't understand the question.
The core of Vice President Biden's argument is that you don't trust the scientists, you don't listen to them. And here up on the podium today, you're twice contradicting the director of your own CDC on the science who testified before Congress today.
No, he's contradicting himself. I think he misunderstood the questions.
Well, he was testifying on
You know what I think? I think he
American
misunderstood. I told you, I don't have to go through this. I think he misunderstood the questions. But I'm telling you, here's the bottom line. Distribution is going to be very rapid. He may not know that. Maybe he's not aware of that. And maybe he's not dealing with the military, et cetera, like I do. Distribution is going to be very rapid, and the vaccine is going to be very powerful. It's going to solve a tremendous problem. It's going to be very powerful.
How can the American people trust you on the pandemic when you're contradicting the head of the CDC and your
Because
own
of the great
administration?
job we've done, because of the great things we've done in other fields also.